What is juvenile delinquency? In simple terms, it is a minor under the age of 18 years old who commits unlawful acts. Minors cannot be criminally charged with a crime, so they are labeled juvenile delinquents. Juvenile justice in Maryland can be traced back hundreds of years when children were jailed with adults and their only crime may have been homelessness. In the 1830s, the state adopted the radical policy of separating juvenile delinquents from adult criminals. The legislature passed an act to establish a house of refuge for juvenile delinquents, creating for the first time an authority to provide troubled children with homes, education, and job training. The goal was to not simply punish the youth, but rehabilitate them. Juveniles who are involved in crimes often live in families facing tough circumstances such as poverty, substance abuse issues, high school dropouts, and unemployment. So they may get involved in risky behaviors such as drug use and dealing, violence, or prostitution. When these at risk youth enter in contact with law enforcement, the main focus of juvenile justice should be to enable them not to reoffend. The factors leading the youth to commit crimes are very complex. Social, political, and environmental factors that strongly influence teen criminal behavior must be understood in order to fight it. Once a juvenile is caught breaking the law and they are apprehended, they are labeled a juvenile delinquent. Knowing what a juvenile delinquent is only a small part of the issue in comparison to what leads a juvenile to become delinquent in the first place, the risk factors, and ways to support them. Many of the causes of juveniles participating in risky behaviors are their family dynamic, peer pressure, substance abuse issues, parent neglect, and many other reasons. Children are heavily influenced, so when they are struggling with issues at home with parents who are neglectful and non supportive, along with peer pressure to engage in harmful behaviors, that is usually where the unlawfulness begins. And if preventative measures and interventions don't take place quickly, things escalate, research shows. 39 studies on four outcomes measuring delinquency or closely related outcomes suggest mentoring for high risk youth had a modest positive effect for delinquency, aggression, drug use, and achievement. Many at risk youth lack positive role models, and that is why mentoring and having positive role models to look up to are very important for rehabilitation and intervening negative behaviors for the youth. Mentoring is one of the most commonly used interventions to prevent, divert, and remediate youth engaged in or thought to be at risk for delinquent behaviors, school failure, aggression, or other antisocial behaviors. I have worked as a mentor and have firsthand knowledge on the positive influences that it has on youth's well being to call on when they are trying to make better decisions, who supports them and helps them understand what better decisions are if they don't know. It can be life changing. That is why it is so important to support the disenfranchised youth by providing programs, services, and interventions to help keep them away from the juvenile justice system and adult justice system using preventative measures.